Let me hear your war cry. Oh, thank you for joining me another episode of Beating Cancer Today, the podcast where hope meets action. I'm your host, Kevin Hennies, a stage 4 colorectal cancer survivor. Against all odds, I defied the doctor's predictions and took my health into my own. Now, I'm here to share my journey and alternative methods that help me. But it's not just about my story. It's about yours too. Join me as we navigate through the challenges of cancer together, providing support, insights, and empowerment. Together, we'll beat cancer, one episode at a time. Let me hear a war cry. Oh, welcome to another episode of Warrior Wednesday, brought to you in part by our new website, www.beatingcancertoday.com. You can still find us on just about every social media platform, but after meeting a series of censorships and people were trying to stifle us, I decided to circumvent all of the efforts of being censored. We've been able to secure an offshore server that we built a website off of, and the page is still being added to, and it's being built up every day. But follow, like, check us out. It's active now. Follow, like, and subscribe to us, beatingcancertoday.com, so we can continue growing and funneling the series followers to that site so we're not censored. But I'm going to jump right into it today. Victoria Andarcia, she's a medical doctor. She's interested in addressing the root causes of disease and getting people off of medicine, which, folks, I've been preaching it for a while. We can do this. We can get ourselves off of medicine. She's going to tell us how today. She's a medical doctor, board certified in internal, integrative medicine, and functional medicine. Dr. Andarcia, please introduce yourself.
Hi, well, thank you for having me. And yes, you are correct. I am board certified in internal medicine, and I did additional studies in integrative and functional medicine. And this came about during my internal medicine residency when I was in the hospital realizing that we were just putting Band-Aids on things. So I started looking for different approaches, and I realized that there were doctors out there that were looking at root cause disease, and that's how I got into integrative and functional.
Well, you know what? I guess I should start by asking you, can you explain how, because, well, for me personally, like I have cancer, so I have a million different doctors and a million different kinds of doctors and homeopathic doctors and this and that. Yeah. So can you explain how integrative and functional medicine approaches cancer care, like in a different way than a conventional medicine or practice?
Yeah. So, I think both approaches are important. But I would say the first thing is prevention, right? Like if you have any client, you're going to talk to them about prevention, which is something that we don't really do a lot in Western medicine, which, before we started the podcast, we were kind of talking about metabolic reasons why people would develop not just cancer, but any chronic disease, right? So really addressing certain issues that may lead to the development of cancer or chronic disease. That's one. But then when you're looking at someone who already has cancer, right, it's what things can we do or use to support them during that time? You mentioned, intermittent fasting. And intermittent fasting was first being studied on patients with cancer because they were having less side effects from chemotherapy during that time. And that's where that started. And then, it became a trend that a lot of people are following.
Is that where it originated from?
Yeah, that's where it originated from. The studies were on people who were undergoing chemotherapy.
Wow.
Yeah. So then it's just like you mentioned homeopathy, like what herbs can you use for someone who is developing nausea or is having GI symptoms, right? It's about supporting them. And then the other thing I would say is there are studies, and a lot of people don't know this, but there are studies being done on the gut microbiome and how the bacteria in your gut determines how you respond to certain chemotherapies. There's a bacteria specifically called Akkermansia. Not sure if you've heard of it. Yeah. But yeah, so they've done studies and they've seen that people who have abundant amounts of Akkermansia in the gut respond better to chemotherapy. So really it's just how can you use these tools to optimize therapy and, improve survival and prognosis and, symptoms, basically.
Now, now, so I'm a very visual person, right? Like I'm not that bright, to be honest with you. I'm kind of a visual person. So I always like to know who I'm in the room with. I mean, I'm actually, you know what? This is what's going on here. We're just going to go ahead and get rid of these things because I could hear you just fine. So, and Chris is actually not in my ear right now. So, but so you always want to know who you're in the room with, right? So I went ahead and, not knowing what I don't know, right? I wanted to know the answer of how would one explain the difference between integrative and functional medicine?
Mm-hmm.
And it kind of it allowed me to break it down in my simple mind, right? Integrative medicine integrates proven complementary therapies with conventional medicine.
Yes.
Right. So wouldn't that be like taking a cancer protocol, like say a fenbendazole based protocol, coupled with being on chemo, Western medicine at the same time?
Yeah.
So an integrative medicine doctor would be open to the fact that I was taking a protocol, an orthodox protocol, probably, in conjunction with chemotherapy, and they wouldn't have an objection to that?
Well, I think it depends on the integrative practitioner, right, and their level of comfort. But essentially, yes, right. There is not one answer to one issue. So most of them are open, but you would also add, like, for example, acupuncture, or you can add like homeopathy. So it's just like blending all these alternative therapies with what you were doing and the chemotherapy.
So, Doc, and you know what? You're very modest, by the way, because I didn't read off any of your accolades or education or anything like that, because I was hoping that you would boast about yourself. But you are an extremely educated woman, and you are, I've read up on you. You're very complimented in your field as an integrative medicine person, right? A practitioner, so to speak. What is your opinion of a anti-parasitic based protocol in conjunction with Western medicine?
Well, I use that a lot in my practice. So that
no, do you? See,
I
totally thought I was going to put you on the spot here, and it was going to be a gotcha, like what's your opinion? But you're telling me that you actually use this?
So not the exact one that you use, but I do parasite cleanses with my patients. And so the reason I think it's important, and it has to be studied more, but why you probably had success with it and it has been successful, is because the gut bacteria we have determines our health, right? So I think that if you alter the gut microbiome, it can change many things. So you did it for cancer. I work a lot with women who are having fertility issues. And I had one recently, she finally got pregnant, and she was telling me yesterday, we worked on her gut, right? With, parasite cleanses and other things that we did. And she said that she just got enrolled in a study on IVF and the microbiome. And so that is something that's being studied. We just don't know about it yet. So as far as you mentioning the parasites in your gut, I would say that they're hard to detect, and it's more common than we think. Just because we live in the United States doesn't mean that we don't get parasites.
Yeah. So that's now in reading up on you, your background,
Venezuelan.
Venezuelan. So do they do in Venezuela? Do they do cleanses annually or anything like that? Parasitic related cleanses?
So not that. I mean, They're very common. My mom will tell me stories of like, parasites when she was growing up, but not that it's part of their wellness routine that I know of. But I do know, for example, I met someone who was from Nicaragua, and they do part of like their wellness routine is 2 parasite cleanses a year. Right, is what she was saying. At least in her family, that's what they did. So I think that there are some areas where it is part of the culture. And when I went to medical school in St. Martin, and it was a Dutch doctor, maybe because it's partly Dutch island, but there were people who would go to him and would routinely ask for parasite cleanses. Right, they're like, I don't feel good, I need a parasite cleanse. And it was just part.
This is not a taboo thing. This is not crazy. I wasn't trying to commit suicide when I did this. Yes, I was desperate, but I was trying to save my life. So it wasn't like a roll of the dice. It was a little bit calculated. I did research things. When I got onto this fenbendazole, for me, it was a leap of faith. I felt like a series of events had happened in my life where I thought this was God's plan. I thought if there was anything that was going to work, this was God put this into my path. It just the way it happened. That was personal to me. However, once I got onto it, I did a deep dive. And had I saw anything to the contrary, I would have stopped it. But there was nothing but positive data. There was nothing but success stories. There was nothing but so it wasn't like I was trying to just willy-nilly pick stuff out of the air. Everything that is in my cocktail has had a clinical trial through Western medicine that was published and proven. So it was peer-reviewed in the whole gamut. So I wasn't reckless. You know what I'm saying? This wasn't like a reckless thing. Kind of to the contrary, it was very calculated. But having said that, functional medicine, conversely, right? Functional medicine focuses on identifying and addressing underlying causes of disease through a system of biology and personalized treatment plans. So is that conflicting the theories that you have with integrative medicine?
No. So I did integrative medicine and I felt like something was missing. I understood these alternative therapies, but it was just like, okay, but how do I wanted to do more. How do I navigate? Yeah, I can use aromatherapy and this and that, but I wanted to kind of dive deeper. And with the functional medicine, I think they can all complement each other, because I can tell someone hey, you're having these issues because of this, this, and this. I use a lot of herbs too, but these herbs, especially some people don't like taking medication. You can use these herbs to help, X and Y symptoms. It helped me kind of blend everything together, because I don't think that we can be so narrow-minded, but it also helps me with my patients, because I have patients that tell me, if you had come to me and you said, I don't, this is what I'm going to do. I think if I had just stayed in the internal medicine track, I would have been like, what are you doing? Right. But then having all these options available and the knowledge of all these different areas allows me to be more open-minded when someone does come to me and say hey, I read this. What do you think?
Well, so part of this identifying and addressing underlying causes of disease, you had mentioned a few times just during this podcast that gut micro, your GI stuff, your gut microbes and stuff. So obviously you're already looking in the gut, but have you found, because part of functional medicine by definition is addressing the underlying causes of diseases through a system of biology approach and personal treatment plans. So see, I did all this before I talked to you. So have you found that there's any other underlying cause of disease other than food?
Well, that's a loaded question, because I can go on that for a long time. But
we're gonna be on it for the rest of this conversation is going to be about food. I can tell you, it is not my friend anymore. So I'm like a crazy ex-girlfriend that just wants to just discredit the hell out of food. Like
Yeah.
I just feel so betrayed by food. So, but go ahead.
Well, so I think food is important. But I think what I would say, well, majority of people are not eating the right things, the majority of people. So let's just do that. But then even if you're trying to eat very healthy, one, our food is nutritionally depleted compared to what it used to be. I remember I was reading this study and it was crazy. I always use it, but if we wanted to get the same nutrition that our grandparents did from an orange, one orange our grandparents were eating, we would have to eat 8. Okay.
Wow.
And the other thing is that there's a lot of environmental toxins that we're exposed to, right? So even if you're trying really hard to avoid environmental toxins, that also plays a role in what you're consuming, whether you're eating it, whether you're touching it, or just breathing it in. And I think that all these things impact our detox pathways. I think detox pathways are really important in the development of disease as well. Like if you're not able to eliminate things properly, and then so I would start, with that. So food is important, but also there's other factors out of our control that play a
Okay.
role.
So that was a long way. That was a lot of words to tell me that food is important. So
Yes, food is very important, but it's not, it's like,
you honestly don't think
yeah,
that, I mean, obviously you have to survive, but
yeah.
what is your diet like? Do you honestly think that you personally are eating the way your body is intended to receive food? Does that make sense?
Yeah. Yeah. I mean, I try the best that I can, but not always, one, right? Like
Because in society, it's hard, right?
right.
Like,
It's hard. And then I think I have people who are like, well, I don't want to take supplements. I should get enough nutrients from my food. That's not really true. So I mean, I don't know about you, but I supplement. I have to supplement because I also know that my diet is not perfect. And, I do need my omega-3s. I'm not eating seafood or mackerel and herring all day. So it's
yeah,
just like you do have to supplement. Um,
yeah,
and I think that we just don't pay attention to that
yeah. I mean,
as
I
much.
was a charter captain in Isla Morada, and I was in the sun like around the clock. As long as the sun was in the air, I was out in the sun on a boat, exposed, and my vitamin D levels were low. I supplement with vitamin D. So, like, I mean, everybody has a low vitamin D. I don't care what you do. Everybody, we all
Yeah.
have low vitamin D. And so yes, I do supplement. But if you don't think, or if you question as to whether, well, not even that. I mean, it's a fair statement that food in one way or the other contributes to disease,
Right.
right? Like
I
what
agree.
we are consuming, right? So it's not about what we're eating; it's what we need to eliminate what we're
Yeah.
eating, right? So like it's not what we're like. Oh, you're going to eat different stuff. No, you just got to cut out certain stuff.
Yes.
It's like that's really where I was going with that. But how do you incorporate diet and lifestyle and complementary the therapies into cancer treatment plans? Like when for your patients, how do because from my understanding in medical school, you don't really get a whole lot of chapters on nutrition.
No, I don't remember any. I've always been interested in nutrition. So I think it's something that I just ended up learning on my own and then supplemented it with the integrative and functional medicine. But I do think I have been in the room when someone has, cancer and they're not eating, right? Because your appetite can be suppressed, where the doctor or the nurse will be like, oh, just eat whatever you want. If you want to eat ice cream, just like as long as you're eating something, right?
Yeah.
Or try the boost shakes, those hospital, those are horrible. Those
Oh
have
yeah.
like, I don't know how many ingredients. I can't even count how many. And it's just
Oh
not
yeah.
good for you. So I do think that when it comes to one of my patients, whole foods, right? Like whole foods and a focus on vegetables and things that are going to help, right? Your digestion, constipation, and things like that can happen. I think fasting is great. it's not very easy for a lot of people to do. But as far as food, we're looking at whole foods, fasting if you can, and then lifestyle. I think that one of the things that is the most difficult, but I try to incorporate in my practice, is the mental health aspect, right? Like, how are you dealing with the stress that comes with a diagnosis like that? I don't think that you can't really underplay that part, right? How stress affects your physical well-being, right? Because you have the cortisol levels, and if they're too high or too low, then it affects your energy levels, and cortisol in itself can be inflammatory over a long period of time, right? So like, how are you dealing with all these things that are happening? Is it journaling? Is it meditation? Or is it exercise, right? Because exercise is another really important thing. And one of the things that I would say is it doesn't have to be high impact exercising.
No, I don't like I exercise, but I don't lift weights. I do yoga.
Yeah.
I work on my mobility because when I got sick at my sickest point, mobility was the first thing to go. And
Mm-hmm.
I was screwed after that. When I lost my mobility, I lost my independence. I lost my continence. I lost everything. I had colon cancer,
Yeah.
colorectal cancer. So with no mobility, I couldn't get to the bathroom. I couldn't, there's just things that came into play that when you lose your mobility, you're doomed. It's just it's a spiral downfall from there. But I do have a question about you know well, as it pertains to diet and stuff. What role does your metabolism play in cancer development? In the progression of the development and progression, what the, depending on your diet, like you said, you've seen where they're just saying feed yourself, feed yourself, feed yourself,
Yeah.
regardless of what the content is. It's about quantity, not quality, because they're just trying to keep your weight on to
Right.
prevent cachexia from setting in, and so they just want you to eat. And I guess feeding the cancer is not as damaging as you losing the weight. I don't know. I don't know what the rationale is there, but um, what you're eating will play the part of your metabolism
Yeah.
and the speed of your metabolism. So, what role does the metabolism play in cancer development and progression? Do you have an opinion about that?
Yes, I do. Okay, so we're living in a society now where, is it 50? I think it's almost 50% of Americans are diabetic, right? And we use this marker called like A1C to see if someone's diabetic. But years before that happens, right, before the A1C shows diabetes, you're going to see a high fasting insulin. Have you heard of that? The fasting
Yeah.
insulin levels? Okay. So, and I do this test in my clinic for everybody. A normal fasting insulin, if you're being generous, it's less than 7. But if it's lower, it's better.
Mhm.
And that can be elevated for 10 years before your A1C shows that you're diabetic. Now, the reason I'm bringing that up is because insulin has been shown to feed cancer cells, right? It's like a growth hormone for cancer. Diabetics are more likely to get cancer, right? And so I'm not saying that, just because your A1C is high is you're going to get cancer, but I'm just saying it is a risk factor for the development of cancer. And so things that bring down your A1C level is obviously dietary, right? Focusing on a more ketogenic diet. If you can, plant-based diets can do that too, fasting. And there are a lot of studies that show that ketogenic diets can help decrease the activity of the cancer cells. And there's a reason why we do PET scans when someone has cancer. You know what the PET scan is doing, right? It's feeding like glucose into the cancer cells, and then they light up,
Yeah.
right? So there's a reason that they do that, because cells love glucose. It's a form of energy. So if you cut off the energy supply, then you can decrease the size or even improve the efficacy of the chemotherapy or treatment that you're doing.
I'm getting excited about this, Doc, because now you're starting to talk my language. This is what I wanted to talk about. Just what you said about the sugar well, we'll circle back to it. Hold on a second. So how can metabolic factors be assessed and addressed in cancer treatment? So, what we're feeding. I mean, you kind of just addressed it with feeding the cancer, right? We're feeding it. So, but the metabolic I don't know if you could hear me if I'm leaning
I can
back,
hear you.
but the metabolic factors, should we change? Well, I mean, obviously you have to change the narrative if you expect to control the outcome. Metabolically, what got you here should change, right? So I guess that was really my question. Whether the metabolic factors are addressed in cancer treatment, because I don't believe they are.
No. I think it takes, I was listening to Mark Hyman. I don't know if you know who he is. He's a functional medicine doctor, but he says it takes 10 years from like a study and like new evidence to show up in our medical practice, because like things are changing so quickly. So my point in bringing that up is that unless you have a doctor that is really up to date on the information, that hasn't gotten there yet.
Yeah.
Right. And doctors are so busy. So it's really hard to keep up with all the information, especially with cancer treatment, because there's new things coming up all the time.
And nobody likes change. You know, like if you're in the military and you have a way of doing something one way, and then the command staff of the military comes down and say, we're changing all this stuff, you're going to have a bunch of upset grunts. Like the worker bees don't like to change things. Mm-hmm. It's just, it disrupts things, and, it's just not what you know. So then it becomes a guessing thing or whatever, and you're not comfortable with it. I get it. But currently there's been, for the people that commit to it, the metabolic approach.
Yeah.
And for those people that committed to it, in conjunction with taking a protocol, it's been effective. And there hasn't been really much data. I mean, for the people that it didn't work on, or that it's not as effective on, they're kind of straying from the plan. But the ones that commit to it and the ones that are disciplined, it is shown to be effective in every case. Whereas chemotherapy does not show the same results, and the Western medicine approach currently is not showing the same results. So what's your opinion of the metabolic theory of cancer in comparison to, not in comparison to, because I think there's a place for it, but I think there's a place for the Western medicine. I'm not vilifying Western medicine at all. It saved my life. If you understand the job of Western medicine, that job of chemotherapy is not to eradicate my cancer. It's to kick the can down the road just long enough for something else to pop up and maybe we figure this thing out. But it's not going to eradicate my cancer. So for me, it worked. It kicked the can down the road for 3 years. And thank God something stepped up, right? And something surfaced and worked out for me, but not without putting in the work. I did take the metabolic approach to things, and I put in the work. I had to change my lifestyle. So when you're trying to reduce or eliminate the medication that somebody's taking, how important is it to consider your diet? Because that's the first thing I did when I was fighting cancer, and then after getting through disease parts, then my sugar got better. I wasn't diabetic. Everything else kind of fell into line once I adjusted my lifestyle. So how important is that to consider?
I mean, nothing changes if your lifestyle doesn't change. I firmly believe that. I think people come to me and they're like, what can I take? No, what are you doing? right? Like, it's not what can you take? What are you doing? What does your nutrition look like? Are you moving? Like, what's your mental health state currently? And I do agree that nutrition is probably one of the biggest, like, if not the biggest thing that we can pay attention to when it comes to not just cancer, chronic disease in general, but specifically when you're talking about cancer therapies.
Well, it's funny that you mentioned mental health a couple times, and I talk. I have these podcasts and stuff, and if I'm being real, I'm a great cheerleader and everything, and but when I was going through it, I need to remind myself sometimes to, especially when I'm talking to other people, I need to remind myself how fortunate I was when I was going through it. I had a wife who was just a godsend. She was just relentless and taking care of me, sheltering me through of negativity, and she dealt with everybody on my behalf. She was like, nobody got to me. I didn't know what was going on the news in the world during the pandemic. I had no idea. She fired my home health care so she could do the caring for herself because she didn't think they cared enough. I had that. Many people don't have that.
Right.
Very, very few people have that. I also had a family who was ridiculously, overwhelmingly supportive at my side all the time, flying in from other states. Didn't matter. Nothing held them back from caring about me. I had the VA. I had the VA to steer me in the right direction, handle a lot of the financial burdens, do a lot of the things that other people don't have, mainly circling back to mental health.
Yeah.
The benefit that I got, I talked to 2 different counselors every 2 weeks. So twice a month, I would talk to 2 different, so 4 times a month, I was talking to counselors from the VA about my mental health. What a benefit that was. What a benefit that was. Because you know what? I wasn't crazy. But you know what? You start to think about crazy things. I had to plan my funeral. I had to go through my things. I was selling my boat, selling my truck, getting rid of it. I was thinning it out because my prognosis was certainly, it was certain. I was definitely dead. If my prognosis was in a box, the Western medicine box, yes, according to them, I was dead. But there's that box. If you open the box, there's so much else out there, right? The potential, right? So anyway, that was a little bit of a rant. Sorry. But
I think it's important because I don't think that we look at that enough, right? And like, what if you hadn't had the support? You hadn't had, those meetings with people. I think that your mindset, if you had just said, I give up, right? If you had just said, I'm done.
This story would have a much different ending. There wouldn't be this podcast if it wasn't for mental health and my support system. If it wasn't for my family around me and my beloved wife, if it wasn't for that, I would not be here. Take fenbendazole out of the picture. Take all the medicines out of the picture. If it wasn't for that circle of people, this doesn't happen. This interview here doesn't happen.
Yeah.
But that is the first thing that somebody with a diagnosis should do is circle the wagons. Circle the wagons, establish a support system, and you don't have to talk to them every day, but that one day they better pick up the phone.
Right.
It better if that's the ride or die that I'm talking about. Right. So it doesn't have to be your family. It doesn't have to be whatever. There's some family members I cut out because I love them, but they were toxic. They're like, oh, well, that's not going to work. Well, you know what? You got to go. See you later. Yeah. You got to listen. I love you. I'll circle back. But right now, it's not your time. I need no negativity in my life. I'm, you know what? You can't have it. You just have to eliminate all the toxic stuff, right? So that being one of them. And your diet, it's not about what I started eating, it's about what I stopped eating. That was it. It wasn't like I didn't say, oh, well, what kind of diet did you? I didn't do a diet. I
No.
just
Yeah.
stopped killing myself. I stopped committing suicide. And oh, well, let's circle because you kind of you poked me a little bit and it got my attention. So here it comes. Sugar as it relates to chronic disease, cancer, diabetes, heart disease, high cholesterol, brain disease, inflammation, Alzheimer's, dementia, diabetes, cancer as it relates to chronic disease. I'm sorry, sugar as it relates to chronic disease. And I know you're not a nutritionist, but I figured as in the practice that you're in, you would at least understand the metabolic aspect of it. And I know that you're well versed in this category. So that's the only. I'm not trying to do the I gotcha thing. I'm sorry.
Oh no.
But
no, not at all. Yeah.
no, I don't mean to, because we didn't discuss this. You probably thought we were talking just about cancer, but this conversation is going to slowly morph into a cholesterol related issue and statin drugs and, brain disease, Alzheimer, dementia, as it relates to statin drugs, as it relates to cholesterol, as it relates to sugar, as it relates to diabetes. So do you see where I'm going with this?
No, I do. No, and I'm happy that you brought it up. I don't think I talk about it a lot, really, but I do think that, like I was talking about, like the insulin issue, our diet has caused a lot of insulin resistance, right? Diabetic or not. And sugar causes inflammation. High sugar, not only is it causing inflammation, but it's driving up those insulin levels. If your insulin is high, that affects cholesterol, believe it or not. So then your cholesterol will get higher. Sometimes I tell people like, hey, you're insulin resistant. If we can just bring that insulin level down with fasting or whatever, your cholesterol levels will get better, right? If that's something that they're worried about. But dementia is very scary because the numbers are rapidly rising in conjunction with this rise that we've had with metabolic diseases, right? With diabetes and high cholesterol and all that, because it kind of goes together. And dementia or Alzheimer's is known as type 3 diabetes for a reason, because if your glucose is high for a prolonged amount of time, that starts to affect, it affects everything. Diabetes affects everything. It affects your blood flow to your feet. That's why some people lose their toes and their legs, and it'll affect the blood flow to your kidneys. And so people get kidney disease, and your eyes. And so then dementia can develop later on down the line. So I do think that, and sugar's at the bottom of this, but it's not just like regular sugar. Then you see people who are using all these artificial sweeteners, and artificial sweeteners, believe it or not, can be worse than the actual sugar. So yeah, I would say sugar is a big issue. And it's in everything. I've seen bread. I've seen bread before, just a piece of toast, and it has sugar in it. And you're like, why does this piece of bread have sugar in it?
Yeah, I was just reading, you're from Florida, right? So we have Publix grocery stores. The ingredients in Publix bread, which I always thought was like, that's from the bakery, that's not, there's like a bunch of ingredients in there. And some of the ingredients in there are cancer causing ingredients.
Yep.
I mean, I'd have to have it in front of me to read it off to you, but yeah, no, there's some toxic stuff. And even the purest of foods that you think, oh, well, this is mom made this or whatever the case, like there is no innocence anymore. There's no more innocence. But here's the kicker though. I just put together a chain of chronic illnesses for you, right?
Mm.
I'll do it again. Cancer, diabetes, heart disease, high cholesterol, brain disease, inflammation, Alzheimer's disease, dementia. And then cholesterol as it pertains to the statins. So is there like you just rattled through them all? Like, of course there's a connection.
Yeah.
Can you explain that connection? Why are we dealing with, I mean, you kind of already did, you touched on the insulin levels being high, and all those people with high insulin levels, the diabetes patients, they're probably going to have high cholesterol because of that, right? Accurate.
Yeah.
So that checks off the insulin levels. It checks, because of the sugar, and it checks off the insulin levels, checks off the cholesterol, right? And their cholesterol is going to be high, creating heart disease. Check.
Yeah.
Which is going to put them on statins. Check. Which is going to cause a reduction in cholesterol, right?
Yeah.
But that reduction in cholesterol, that's your LDLs, right? Your bad cholesterol. And the LDLs are generated from your liver. That doesn't come from what your diet is, right? It comes from your liver. Your LDLs are made in your liver. Am I wrong?
Yes, made in your liver. But here's one thing I'm going to say about cholesterol, because I have had patients with high cholesterol who don't necessarily have to be on a statin, because we're just doing like that short lipid panel, the one that you get from your primary care doctor. They're not looking at lipid size, the type of particle, right? Like ApoB is now, like, people are talking about ApoB because, if you have let's say you have a high LDL and you have high ApoB, that's more concerning. So I think you have to look at the whole lipid panel, right?
Yeah. So the high LDLs, that doesn't gauge the size of them.
Right. It's just telling you a flat number. And so the reason that I'm saying that is because, yes, that you're getting that in the liver, like, it's a whole process, but I do think that your diet impacts what is going on.
Well, of course. So therein lies my question. If the LDLs are these bad cholesterol, right? They're all these villains, but your body is creating the LDLs. So your body's not hurting you by creating the LDLs. Right. You need those LDLs. So that's why your body's making them, right? So you just can't have too many of them or whatever. Right. But so they tell you to curb your diet and change your lifestyle and this and that or whatever. But at the same time, the LDLs that they're trying to get rid of are in your liver. It's not coming from your diet, right? So they're not suppressing the cholesterol that you're consuming. They're suppressing the cholesterol that your body's making. Yes. Your body's making that for a reason.
Right. Yeah.
Right.
I agree with you. Yes. And that can lead to other issues. Not that I have anything against using medication, but I do think that, one, you need cholesterol to make hormones, right? So I think that if you suppress someone's cholesterol too much, you're going to affect their hormone levels. Specifically, if you're looking at men, you're suppress their
Can we put a pin in that?
Yeah.
Can we put a pin in that? You hit the nail on the head, right? So you're just adding. You're illustrating my point, really. So the statins are going to create brain deterioration, right? Because 75-80% of your brain is cholesterol?
Yes.
Yeah. So it's going to create it's going to contribute at least to brain disease. And then, now you can't get an erection either. So you can't get an erection. But it's not because of the statins. It's because you're sick, right? So we got to put you on another drug to get an erection. But it's not all about erections. Urine. You can't urinate. So we're going to have to put you on another drug.
Yep.
So now, because of that statin, I'm on 4 more drugs. My brain's gone. And my body's still producing the same amount of cholesterol in the liver. It's not any different. So I controlled it by my diet. I didn't control it by the statin, but what that statin did do is put me on 4 other medications. Oh, yeah. And I'm depressed. So you're going to have to because my wife left me because I can't have sex with her. So you're going to have to throw me on an alprazolam also.
Yeah.
Put a little sprinkle some Xanax over it. It'll be nice. You
I mean,
know,
but that's what happens. And like, I'm laughing, but it's a very common story. It happens all the time, right? One thing leads to another, and then you spiral. And then before you know it, you're on 5 different medications.
and it's a slippery slope
Yeah.
because honestly, if it just wasn't for that one misdiagnosis, and honestly, because you're, and I heard this analogy used before. I don't even remember where I heard it from, but um, you are holding your liver accountable for a crime that it's not committing. Like you're putting statins on, to medicate your liver when it's not your liver. It's your diet. It's your food intake that you're trying to control. It's not the liver. The production of the liver makes what the liver makes.
Yeah.
I mean, that's what your body does. That's how God intended for it to be. There's a reason why it's producing what it's producing. So, and there's also a reason why there's die off on liver and why it reproduces. It sheds. There's a reason. God knows what he's doing. It's like, it's crazy. It's crazy. I know. But I digress. So I actually heard, outside of the, 5 or so additional medications that I would be on now, and I'm going to forget to take them because I'm going to have some dementia. I'm going to have a little bit of dementia. It's just, I'm so sorry. I didn't expect for the tirade, but conversely, though, statins, I've heard they're some beneficial or arguably beneficial effects, statins being used for cancer treatment.
Oh, I haven't heard of that.
Because it lowers cholesterol. Cholesterol's sugar or whatever. And you know what? Cholesterol is also a pre-hormone. Let's not forget that. So your cholesterol is high, right? What if I have breast cancer? What if I'm triple positive? HER2 positive breast cancer. What if, what I'm saying? What if I have ovarian cancer? My cholesterol is high. Now I'm contributing, so I'm feeding disease with high cholesterol.
Okay. Yeah, I hadn't thought about it, but if you put it that way, then I can see how it could be helpful.
I mean, the connection, wow. I'm talking a lot with my hands today, but the connection, check. Now, I mean, the connection, right? Like, did that just blow your mind? Like, you don't think about what you don't think about, right? I mean,
right.
It's just, why don't we think outside the box? And I don't know. I don't know if there's any connection. Like, I just spit that out. But in theory, it didn't really, like, you didn't it wasn't like I just said, hey, drinking urine is going to cure cancer. It wasn't like I didn't, like, you actually thought about that for a second.
Yeah.
Right? There may be a correlation. I don't know. I mean, I've read up on stuff, but
right.
That was actually the first time I regurgitated that. But I mean, it's worth thinking outside the box, right? I mean, what we're doing now is not working.
No, it's not.
Would you agree with that? I mean, 1,700 people a day are kicking it. I got diagnosed. I think when you get diagnosed, you have like this, there's like this common ground that you find with people, right? Like the other people that got diagnosed. And you learn like, oh, hey, when did you get diagnosed? When did you get diagnosed? Like you're all in a chemo chair getting pumped full of poison and you strike up conversation about the only thing that you have in common, which is cancer. And, what kind of medicine's in that bag? So you try to like strike up because it's miserable, right? So in my little circle, when I got diagnosed, I had like 5 other people that got diagnosed with me. And I'm the last one standing. And the doctors keep telling me that I have less than a 1% chance to be alive in August of this year. Less than 1% chance. We better get this thing aired before I die. Right. So, but no, they say I have less than a 1% statistically based on my genetic breakdown. And I said, Doc, are you not seeing what I'm seeing? You should have taken pictures, for a timeline or whatever. I've completely changed my lifestyle. I've done it in on these podcasts. You could see the evolution of Kevin. I've completely dialed in metabolically my diet. I've kind of become obsessed with it, really. I told you earlier, I'm on a fast right now. I think I'm
Yeah.
like 36 hours into a fast right now. Actually, I'm like 43 hours into a fast right now. So, but yeah, so I mean, I, I'm always putting in the work. I'm trying to stay ready so I don't have to get ready in
Yeah.
case that less than 1% thing is right. But I mean, I've never felt better. I've controlled my food intake and I feel like I'm 17 years old. I'll be 51 next week. And I feel honestly like I'm 17 years old. The energy that I have is ridiculous. I don't have anything weighing in my gut all the time. It's just really kind of ridiculous. Like, is it this
Well,
simple?
I something I thought about while you were saying that is they're using stats based off what? Off of the normal population that was just getting chemotherapy and did not, probably didn't do anything to address lifestyle,
Bingo.
right?
And normal colorectal people
Yeah.
historically were 80 years old.
Yeah.
I got diagnosed at 46 and I was in good shape. I had a little bit of youth, I guess, if you can consider 46, but I wasn't 80, right?
Right.
So they went a lot more aggressive on me than they would have done to an 80-year-old, I think.
Yeah.
But like with radiation, my radiation doctor had told me, she's like, listen, I'm pushing the envelope here, but you could take it. I think if my condition was different, it wouldn't have been that generous, right? So,
Right.
but I was fortunate in my timing. But the point being is, they don't know you. They
Yeah.
don't know I'm a Marine. I don't know quit. I don't know. What did you think was going to happen? What did you think was going to happen when you said, hey, man, maybe you should just start making some arrangements. Maybe just go live your life. Maybe, see your family and stuff. Take some time. What did you think I was going to do? Did you think I was going to lay down? No.
Yeah.
No, you gotta keep on keeping on. And so for that box, that they were right for that box. But when you start thinking outside of that box, just to get back to that point, sorry, circling back to that point of all of these things potentially, could the statin lower the cholesterol, which is feeding a hormone driven cancer? Could that be effectively used as a repurposed medicine? That is something to consider. But in order to consider that, you got to get outside of that box.
Yeah.
And this is a horrible question. Let me apologize in advance, but I'm going to say it for the factor, the shock factor. Is that what they say? The shock factor. Do you feel like you were robbed by not getting a proper education in medical school?
No, I don't think that that's like, I don't think that that's a shock factor.
Well, they didn't teach you about nutrition. They didn't
No.
teach you about nutrition. They didn't teach, like, there's some things that you didn't cover in medical school.
No, I agree with you. I'm 100% agreeing with you. I just think, I don't know. I can't speak for every doctor. I don't think that's lost to us, though. I think that, especially now that what I'm doing, I feel like I was almost educated on how to make money for the pharmaceutical company. I'm just going to say that because it was symptom, medication, that symptom, medication.
Okay. So that's where I was going with this. Do you feel like you were indoctrinated? Do you feel like you were taught a certain way in medical school for a certain reason, being maybe prescribing the right things or addressing the symptom and not the cause?
Yes.
And by addressing the symptom, you're just prescribing stuff. You're like a pill mill.
Right. That's how I felt. And that's why I was so unhappy when I started residency, because I was like, what is this? Like,
so do you feel cheated by your medical school, the institution of going to medical school, like your MD, that the doctor part of you? Do you feel like
I
you
don't,
were steered?
I don't regret doing it because I think that, I mean, it's led me here, right, to do what I really want to do.
Yeah, yeah.
But I do think that there are a lot of gaps that need to be addressed, but I don't see how it's going to be addressed with the current healthcare system and how it's set up to be that symptom med. Like, for example, I can't take insurance really right now in my with my patients because they'd be like, "What are you doing? Why are we going to pay you for that?" Right? Like, I don't get paid for spending an hour talking to my patients about lifestyle, gut health, all these things. I don't get paid for that. But
Yeah.
that's where the changes happen.
Yeah.
It's more like, what medication are you prescribing? Okay, cool, check.
That's where the changes happen.
Yeah.
That was huge. That just statement right there. That's where the changes happen in the time spent during the conversation.
Yeah.
Not the time with your script pad. Not the time with your pad. It's time in the conversation. Where you're learning about just as crazy as that theory might be of a statin lowering cholesterol contributing to disease. I mean, I don't know how crazy that theory really is. I don't know, but I don't know enough about it to say one way or the other. But what I'm saying is that, I mean, it all comes back to addressing the root cause of the disease instead of being just a pill mill. Because I just gave you an example of how I just got onto 5 more medications by one person at one time saying, I want to treat the symptom instead of the illness. One person making that one diagnosis to treat the symptom instead of the illness put me on all of these 5 drugs. And it was a trickle effect. And then at the end of the month, I'm taking all these new drugs. So at what point in time do you get off of it? Right? Like, are you on these drugs forever? Because they never take you off.
No, they don't talk to you about that part. No.
So, yeah. So I don't know. Anyway, I am so very grateful for your time. And I'm sorry if I was a little long-winded at times or whatever. But do you have anything that you're plugging? Can we throw some plugs in for you? Your business, your practice,
Yeah. Sure. So I have a telehealth-based company, so I can see people virtually no matter where you are in Florida. And I do offer free 15-minute consultations so that everyone, who isn't really familiar with integrative medicine or how I would work with them, they can go ahead onto my Instagram, which is at Healthful Roots MD, or, they can just look me up online and we can schedule those calls. But yeah, that's pretty much what I do. And I look forward to hopefully getting a few people on board here.
I want to circle back. I want to do another conversation in the future because I have a feeling that you're going to see some changes in the traditional approach to treat cancer. I feel like the metabolic approach is going to surface as a regular resource in traditional medicine. How long it's going to take for them to put out a lesson plan, I don't know. But I do have a feeling that it's going to be more difficult to deny the efficacy of this lifestyle. You won't be able to deny it after enough people do it. And there's starting to become a lot. After enough people do it, I don't think it'll be deniable, So, Doc, thank you so much. Folks, look at Dr. Victoria Andarcia up when you get a chance. She's a wealth of knowledge, and I can't wait to revisit this so we could talk about some new information that comes out about the topics that we breached today.
Yes. Thank you so much for having me.
Doc, thank you, and we'll talk to you soon. Thank you so much.